Hi guys, Dr. Money again. So today we're going to be talking about the final thing that we have in replacing spaces in your dental arch from teeth that you've been missing for a little while. And today we're going to be talking about dental implants. Now dental implants have been around for quite a while right now, and they've been researched very, very heavily inside the scientific literature as far as efficacy goes, safety, as well as integration, and things. So they're very, very safe. Now what dental implants are made out of is titanium. So it's the exact same thing that they make artificial knee joints out of and different types of joints throughout your body. Titanium is extremely biocompatible, meaning that it's a type of metal that the body can take very well. Now there are some people that do have metal allergies, and if they have it, then they should talk to their dentist about it too, because there's other options. Now you can get full zirconia, which are milled implants as opposed to titaniums. Those are fairly new, but they're being researched as well. Either option would probably work out great for you, as long as you meet the criteria for a dental implant. Because that's the one thing about getting implants, is we have to have enough bone to be able to put the implant in. So just to kind of show you what a dental implant looks like, this is a pretty good example of what they are. So these are two different types of implants that would replace an upper back tooth. Okay, you can also use it on the lower. The biggest thing is just making sure, and you can kind of see how wide those dental implants have to be. So you have to have not only enough width of bone to be able to put a dental implant into, you have to have enough depth. It's just like, putting a wood screw into a piece of wood. You have to have just enough to be able to go into it and then be able to sink it all the way, or else it's not going to do you any good, or it can split the wood and a lot of other things. There's also certain anatomic things inside your mouth that your dentals to go over with that'll tell you whether or not you're able to get a dental implant done just right out of the gate, or if you have to do things like a sinus lift, bone grafts, and things like that to be able to give you enough bone to safely put an implant into. Like I said, these dental implants are made out of titanium. Now dental implants, what happens after we place it inside of your mouth, we have to go through a little bit of a healing period. During that time, your jawbone actually grows into the metal, so it becomes part of your jaw. So doing dental implants on adult patients is usually the best. What we do first is we put the dental implant in and put on top of it what's called a healing abutment. Okay? Then we use this little screw after everything heals enough, and then we go in there and basically take the top off of it. It's kind of like an erector set, if anybody remembers those whenever they were kids. And we take those out, and then now you have an exposed dental implant down there inside your bone. Now from that we go through and then put on different types of abutments. Okay, now those are going to be different pieces of metal that are going to screw out into that platform that's there, and then it'll have like a little rod like this sticking up to be able to take impressions, and we'll use that to be able to make the final crowns that go on there. Now depending on what type of implants are used, where inside the mouth they are, and different other types of considerations, depends on the type of crown that'll get put on top. Sometimes they're screw retained like this. We go through, tighten it down, and then cover in the hole, and that's it. Sometimes they need to be cemented in, because if not, you'd have a big screw hanging out of your mouth. Nobody wants that. So, those we actually just go in with cement and then put it on there, and it stays in that way. So, the best thing about dental implants is that you get to basically replace a tooth with a tooth. Now that being said, it doesn't feel the same as the rest of your teeth are, but you keep it clean like a regular tooth. You can put floss through every single one of those contact points where your teeth meet each other. You brush it just like a normal tooth. And also, as with normal teeth, you can get periodontal disease basically around your implant. So it's very important if you get implants placed to keep going back into your dentist regularly to make sure that you're not getting, it's called peri-implantitis, around that, where you're losing bone. Because if you lose bone down to where those threads are, it's really easy for bacteria to just go right down there and to set up infections inside your bone. So it's very important to keep going back in and seeing your dentist, even if you have a dental implant done, to make sure that everything's still looking good down there below the gum line.